Paul Davis to move the motion.
It's a pleasure to serve under your chairmanship, Mr. Stewart. Like many colleagues across the House, I was proud to mark Parkinson's Awareness Month last month. This annual observance is more than a symbolic gesture. It's a vital opportunity to raise awareness, challenge misconceptions and advocate for the thousands of people across the UK who live with Parkinson's every day. It's also time to reflect on the progress we've made and, more importantly, the work that still lies ahead. Parkinson's is a condition that touches every corner of our society. It affects over 150,000 people in the UK, and that number is expected to rise to 172,000 by 2030. In my own Colne Valley constituency, there are an estimated 253 people living with Parkinson's. These are not just statistics, they're our neighbours, our friends, our family members. And behind each number is a story of resilience, of daily challenges and of hope. Parkinson's is a progressive neurological condition. It is complex, degenerative and life-limiting. It affects movement, speech, cognition and mental health. There is no cure, and while treatments exist to manage symptoms, their effectiveness often diminishes over time. The condition manifests itself differently in each person. Some may experience tremors and stiffness, while others struggle with depression.
Order. Order. The sitting is suspended for 15 minutes for a division
Of the House. Just when you were getting going.
I know.
Apologies.
Well, just more. I didn't think I'd get that far, I must be honest.
Order. Paul Davis.
Chair.
This variability makes Parkinson's particularly challenging to diagnose, treat and manage. In West Yorkshire, the Integrated Care Board is responsible for planning and delivering care for people with Parkinson's. In 2023-24, spending on hospital admissions for Parkinson patients in our area rose by nearly 5%, with each admission costing over £6,000. These figures underscore the urgent need for a more proactive, community-based approach to care, one that prevents hospitalisations and supports people to live well at home. Today I want to highlight 5 critical areas where we must act to improve care for people living with Parkinson's: workforce shortages, support from diagnosis, timely medication, prescription charges and access to innovation. There is a severe shortage of neurologists and Parkinson's specialists in the UK. Neurology services are only meeting the 18-week referral target for about half of the time. The UK ranks near the bottom in Europe for the number of neurologists per capita. This shortage leads to delayed diagnoses, missed treatment windows, and a lack of access to essential multidisciplinary care. Only 44% of patients in England have access to an occupational therapist, 62% to a physiotherapist, and just 40% to a speech and language therapist. These professionals are not luxuries. They're essential to managing the condition and maintaining quality of life. Investing in this workforce is not only clinically necessary, but financially prudent.
Will my honourable friend give way?
Of course.
Thank my honourable friend for giving way. One of my constituents in Leeds South West and Morley is a strong advocate for the Parky Charter. And while I understand that the government can't commit to everything that's in that charter at the moment, I wonder if my honourable friend would agree with me that at every fiscal event from now until the end of this Labour government, the government seriously considers investing in these services and these professions that he's talked about, or at the very least outline exactly what they're doing to get neurological conditions the support and the help they need.
I'd like to thank my honourable friend for that intervention and absolutely agree. I think this is crucial. We know the impact it has on individuals. I'll mention later on about 2 of my constituents that I've been working with. I know the impact this has on the community, so absolutely agree with you. Parkinson's costs the UK £3 billion annually. Much of this is due to unplanned hospital admissions and the lost productivity of unpaid carers. Too many people with Parkinson's feel abandoned after receiving their diagnosis. Nearly a quarter report not being given adequate information or access to support services. This is totally unacceptable. Of course.
I thank the honourable member for giving way, and I defer to his great wisdom in this matter and his very helpful outlining of the points that he intends to cover. But I want to add another aspect to this. The government's review of disability benefits may lead to a pressure on people in receipt of personal independence payments. And it's poorly understood that those people are receiving those payments in order to allow them to continue to work through making adjustments. But would the honourable member agree with me that there's an opportunity for the government here to learn from the system in Scotland, where you've got adult disability payments, which is a much more humane process and will allow perhaps people with Parkinson's in receipt of personal independence payments? It's a fluctuating condition and it may be missed. So would you agree that there's an opportunity here to learn from the system in Scotland?
I'd like to thank the honourable member for that intervention. From my perspective, I think we have to keep an open mind. We have to look at what's being done in other places, in other countries, in other regions as such, and learn from that. So certainly from my view, that we absolutely should take that on board and look at whether there are changes that will come in the future related to good practice elsewhere. So again, I'd like to thank you for that intervention. A diagnosis of Parkinson's is life-changing, and patients deserve immediate, comprehensive support. That's why Parkinson's UK launched Parkinson's Connect, a pioneering programme that enables healthcare professionals to refer newly diagnosed patients directly to a network of support. This includes access to specialist nurses, care advisors, local support groups, and educational resources.
Honourable friend for giving way. In my own constituency, I think what I want to say is to look at things in a positive way, just for a moment. So in my own constituency, the local newspaper there, Drogheda and Saltcoats Herald, highlighted that the North Ayrshire Table Tennis Club holds classes for people with Parkinson's, and the take-up of this activity has been very well received. And in 2024, a constituent, Steve Morley from Stevenston, who took up table tennis after his Parkinson's diagnosis to help with his symptoms, played at the World Masters in Rome, which I think is excellent. Would my honourable friend agree with me that it is important to provide support for those with Parkinson's who are keen to keep active?
Thank you for that intervention. I absolutely agree. I think this is not a case of placing people with Parkinson's in a corner and providing them with medication. This is about helping them to lead full lives, improving their quality of life, and actually aiding them to do what they want to do. And I know from the people within the Parkinson's community that I've met so far, that's exactly what they want to do. So absolutely agree with you. Early intervention can make a profound difference in how patients manage their condition and maintain their independence. For people with Parkinson's, receiving medication on time within 30 minutes of the prescribed schedule is not a convenience. It's an absolute necessity. Delays can lead to severe symptoms, including immobility, pain, and in extreme cases, life-threatening complications. Yet, over half of hospitalised patients report problems receiving their medication on time.
A constituent of mine was diagnosed with Parkinson's at the age of 61. Individual sufferers can experience, to varying degrees, the symptoms day by day, which brings into question the effectiveness of PIP assessments, which, results of which can vary depending on when they're carried out. But with medical assistance hard to come by, charities such as Parkinson's UK and Cure Parkinson's are vital to sufferers. Will you join me in thanking them and similar organisations for their support to these thousands of people across the country?
Paul Davis.
Thank you very much for the intervention. Absolutely. The role they play is vital in terms of supporting this community. And I absolutely agree with you. To be truthful, it's inspirational, the people I've met from those groups and the work they do. So thank you for that. Yep. NHS England's Medicine Safety Improvement Programme, running from 2024 to 2027, is a welcome step. It aims to ensure that time-critical medications are administered promptly in hospitals. But we must ensure that this programme is fully implemented and that its findings are acted upon across all NHS trusts. Timely medication is a basic right for Parkinson's patients, and we must treat it as such. In England, people with Parkinson's still face prescription charges. Unlike in Wales, Scotland and Northern Ireland, these charges can be a significant burden, especially for working-age patients who may already be facing reduced income due to their condition. Research shows that eliminating these charges could reduce hospital admissions and save the NHS money. Yet Parkinson's remains absent from the list of conditions exempt from charges, a list that hasn't been meaningfully updated in over 60 years. It is time for a review. We must ensure that no one is forced to choose between their health and their finances. New treatments, like Produodopa, if I've got that correct, I'm getting the thumbs, thank you, approved for NHS use in 2024, offer hope for those with severe symptoms. This medication can be life-changing for patients whose symptoms are not well managed by the existing treatments. However, due to staffing and funding constraints, many hospitals are unable to offer it. We must ensure that all patients who need innovative treatments, like Produdopa, can access them, and that the NHS is equipped to adopt new therapies swiftly and equitably. Innovation must not be a postcode lottery. Mr. Chair, I would now like to turn briefly to my own constituency. Since being elected, I've had the privilege of meeting Dr. Chris Ryan and Mrs. Liz Ryan, MBE. And over a cup of tea in February, they shared their experiences and highlighted the urgent need for better Parkinson's care in Kirklees. Liz, who received an MBE for her services to education, continues to be a pillar of our community despite her diagnosis. Together, they've organised local events, including a Parkinson's choir that brings joy and support to many. Following our meeting, I wrote to Kirklees Council and Calderdale and Huddersfield NHS Foundation Trust to ask what more can be done. I also contacted the Department of Health regarding regular consultations and better medication management. The Minister informed me that the neurology service specification is being updated and will be published later this year. And while remote consultations are helpful, they're not always suitable for Parkinson patients who require regular, holistic, in-person care. I urge the Government to consult with Parkinson's UK during this review. I also had the pleasure of attending the Big Sing for Parkinson's on World Parkinson's Day. This was organised by the Movers and Shakers podcast, and the event was a celebration of community, resilience and hope. And as I said earlier, absolutely one of inspiration for me to witness that community and that strength of community spirit and determination to drive through with their lives was incredible. The group also published the Parky Charter, outlining 5 key needs for people with Parkinson's, needs that are still unmet. This year, 2 big sings were held, one, the one I attended in Huddersfield, and the other in London. And as I say, that brought together people in solidarity and song. So as we move forward, let us remember that Parkinson's Awareness Month is not just about raising awareness, it's about taking meaningful action. It's about listening to those with lived experience, supporting families and carers, and ensuring that our health system is equipped to meet the needs of every person living with Parkinson's. Parkinson's is a condition that demands our attention, our compassion and our action. By addressing workforce shortages, supporting patients from diagnosis, ensuring timely medication, removing financial barriers and embracing innovation, we can dramatically improve the lives of those living with Parkinson's. Thank you.
Right. The question is that this House has considered care for Parkinson's patients. We have 5 backbench speakers, and I'm going to call the front benches at 17:23. So I'll leave you to make your judgment on that, and I'll start with the ever succinct and effective Ed Morello.
Thank you very much, Mr. Stewart, and it's a pleasure to serve under your chairship, especially after that flattery. I'd also like to congratulate the honourable member for Cold Valley for securing this important debate. Parkinson's, as has already been laid out, is the fastest growing neurological condition in the world. But behind every statistic is a family, a carer, a friend, someone whose daily life is shared by this illness. My constituents in West Dorset have written to me about their own experiences of loved ones living with the disease. The stories they've shared are heartbreaking: long waits for specialist care, difficulties assessing the right medication on time, and exhausting battles for financial and social support. I know I speak for many here when I say we must do more. Parkinson's is a progressive condition with more than 40 possible symptoms affecting movement, sleep, mental health, speech, eating and swallowing. Nearly half of those living with it will experience anxiety or depression, and more than half will develop psychotic symptoms as the condition progresses. Across the country, there are long waits for specialist care, lack of multidisciplinary teams with Parkinson's experience, and the serious difficulty of accessing vital medication in a timely and consistent way. We urgently need to overhaul the way care is provided for people with Parkinson's, particularly in rural areas. This begins with primary care. GPs are the front door to the NHS, yet we know that continuity of care has begun eroded. That's why the Liberal Democrats are calling for everyone with a long-term condition like Parkinson's to have access to a named GP, someone who can understand their history and needs and who can advocate for timely referrals and coordinated care. But Mr Stewart, this is not just about funding more, it's about funding smarter. Primary and community care can prevent some hospital admissions and provide medication and essential support for those who cannot easily travel. This is especially important in rural areas like mine, where distance, isolation and sparse public transport already pose significant barriers to treatment. Care services are struggling with conditions like Parkinson's and have been stretched to breaking point by government decisions and lack of funding. Wellmar Hospice Care in West Dorset is a lifetime for so many families. Earlier this year, NHS Dorset announced a £400,000 cut to its fast-track funding starting next April, while Wellmar also faces a £600,000 increase in costs rising from, as a result of national insurance contributions rising and other pressures. They already raise 60% of their NHS commissioned care through charitable donations, and that is unsustainable over the long term. The same goes for our community pharmacies, vital for people with Parkinson's, especially in rural communities. They're not just dispensaries, they provide healthcare consultation, medical reviews, early advice, often acting as the first point of contact for worried patients. Yet the funding model they rely on is outdated and inadequate, leaving many rural pharmacies on the brink of collapse. If we're serious about reducing health inequalities, then we must ring-fence funding for essential services and not allow it to disappear into ever wider budget allocations. Mr Chairman, we owe it to everyone living with Parkinson's and to the families, the carers, the health workers supporting them to do better. And that means listening to the voices of those people affected, ending the postcode lottery and making sure that no one, wherever they live, faces this devastating disease alone. Thank you.
Hear, hear.
Admirably delivered. Navendu Mishra.
Thank you. Pleasure to serve in this debate with you. Can I also congratulate my good friend from Colne Valley on securing this important debate. A family member of mine was diagnosed with Parkinson's about 2.5, 3 years ago. So although I'm not an expert on this issue, I understand how difficult it can be for family members, friends and the community. Unfortunately, my good friend from Yorkshire has used up all my talking points, so I'll keep my speech brief. The figure, as many colleagues have pointed out, 153,000 people, Mr Stewart, have Parkinson's in the UK. But if you look at the figure predicted for 2030, the figure rises to 172,000. So it's a significant increase in 5 short years. So we must do more to support people and medical practitioners in terms of Parkinson's. This point has also been made, but sadly, Parkinson's workforce in the NHS has been facing a shortage for over 30 years. It has been neglected, and the government should address this urgently. The Association of British Neurologists found that there were 1.1 full-time equivalent neurologists per 100,000 head of population involved in patient care in the UK. Now, if you compare that figure for France and Germany, the figure is 1 neurologist per less than 25,000 head of population. So the UK ranks 44 out of 45 European nations for the number of neurologists per population. This figure is simply not good enough. The Parkinson's UK-wide programme, Parkinson's Connect, has been mentioned, and I would urge the government to roll it out across the NHS in England to make sure that more people with the condition get the support they need. This Labour government has made a decision to freeze prescription charges for 2025-2026, and I really welcome that. Unfortunately, Parkinson's is not on the list of medical conditions that are exempt from prescription charges. And my understanding is that that list was decided in 1968 and has barely changed since. So I think independent research suggests that scrapping prescription charges in England for Parkinson's would save the NHS £93 per person per year and reduce A&E visits by approximately 9%. So can I call on the government to scrap prescription charges for people with Parkinson's? And I'll just end on the point of the Blue Badge scheme. Many people, sadly, who suffer from Parkinson's also suffer from a postcode lottery where the local authority decides if they get a blue badge for their transport or not. And I think a lot more research needs to be done on this, and I think the Department for Transport and Department of Health and Social Care should work together to make sure that people with Parkinson's get the support they need. Thank you, Mr Stewart.
Honourable gentleman for Colne Valley for raising this issue. As members are well aware, I've been a vocal opponent of the changes to PIP, and I'm going to concentrate specifically on the PIPs issues and how that affects people with Parkinson's, and why it's really important that government is careful what they do in relation to PIPs benefits and monies in relation to those who have this disease. When we consider the care that is needed for those who suffer from Parkinson's, it is a perfect example of those who may well miss out on the care that they need the most. Now, the woman set the scene so well. The problems with Parkinson's, and those who have spoken before have also referred to them. We can all rightly understand how the personal independence payments cuts may overstretch local authorities and providers. And that will be the NHS in the mainland and our underfunded trusts in Northern Ireland. The entire purpose of PIPs, of course, is not to in some way compensate for the illness. It is to help someone live with the practicalities of the illness, and that's the purpose of why PIPs is there, and why I support it, and really concerned about what's going to possibly happen. This is not a supplement to keep people off work. It can help people in work, as part of what the government says that their purpose is. PIPs exist to help offset the cost of being sick or disabled, and as such is an effective health intervention. However, a recent Freedom of Information request found that 36% of people with neurological disorders are at a very high risk of losing out on PIPs. And this could be even higher, they say, for people with Parkinson's, as even if someone has scored 4 points previously in a daily living category, the rapidly fluctuating nature of the condition means that it's not guaranteed that this will be scored again. So it's understanding what Parkinson's is and what it delivers, and the importance of it. And without the financial support needed to help with additional costs of sickness and disability and the loss of passported carers allowance for many households, unmet need will likely transfer to local authorities as part of their statutory obligations. So here's the scenario the government could find themselves in. They could remove or reduce their personal payments, which will then take away the carers allowance. And it was said in the PMQ in the Chamber today by the Liberal Democrat leader about the £12,000. My calculations indicate that it could be £10,000. So the impact financially will be ginormous.
Will you give way?
I'm very happy to, yeah.
Thank the Honourable Member for giving way, and I'm really glad that he's bringing this point up. Honourable Members have mentioned 153,000 sufferers in the UK. 10% of those rely on PIP, which is vital for them to live and indeed work independently. So I share his concerns that any reduction in their access to PIP is going to have not only serious financial consequences, but also a diminishment of their independence. So I thank him.
And that sums up the thrust of my comments in relation to it. I'm really, really concerned, Mr. Chairman, in relation to what government are pursuing and the impacts that it will have. And this is coming from the people on the front line. I would call them the people on the coal quay who understand exactly what it means. Equally, if people with Parkinson's are no longer able to afford the extra heating needed to help with debilitating muscle spasms, and we have to understand what those things are, then they are more likely to even have a fall. This will increase hospital admissions, stays, social care support for fractures and joint replacements that could have been prevented by making sure that they retained their monies and didn't have to cut corners when it comes to their care. It's not just individual health outcomes that will be affected, with a quarter of councils in England saying they are on the brink of bankruptcy, and other providers across the UK being stretched. This policy could have devastating impacts on local services. I conclude with this, Mr. Chairman, because I want to keep the time that you indicated. I look to the Minister, and when you think, and I mean when we all think about care in Parkinson's patients, we must think of the effect of removing PIP from these people. And I do ask, I know it's not the Minister's responsibility, but if he could convey the concern of this debate today to the relevant Minister in DWP, and fight the fight to ensure that these people have the care they need in the most cost-effective way possible. Thanks so much.
Here.
Thank you. Under your chairmanship, I'd also like to start by thanking the member for Colne Banley for securing today's important debate. Over the last few years, sadly, too many patients living with Parkinson's disease have been left facing, frankly, unacceptable waits to get treated, also to get diagnosed, treated, and then they further face challenges accessing the medication that they need. This, of course, has ripple effects across our communities, and it certainly does in my communities in South Dorset, as this neurological condition impacts not just the person with the diagnosis, but also their family and loved ones too. As many members will be very much aware from their inboxes, there are currently far too many, in fact thousands of patients in England who are on a waiting list for neurological services, with around half waiting for more than the NHS target of 18 weeks. This means many patients' illnesses may have gone undiagnosed, with their conditions worsening as they wait to be seen by the necessary specialist doctor. I know that patients living in coastal communities, including in my constituency of South Dorset, often encounter specific challenges when accessing healthcare and also face high incidences of long-term conditions such as Parkinson's. Too often, patients in my community are confronted with a long wait for an appointment with a specialist and a long journey to the nearest major hospital. And of course, as has already been mentioned, this problem is compounded by a national shortage of Parkinson's specialists. Now, more than 20 constituents have written to me to raise this worrying state of affairs. Parkinson's is the fastest growing neurological condition in the world, and we must do more to support those who've had their lives changed by this disease. I join my constituents in South Dorset and charities such as Parkinson's UK in their support for the Parky Charter. This charter sets out 5 principles to improve care for everyone with a Parkinson's diagnosis. These principles, which the Home Secretary has rightly pledged to support, include delivering referrals in under 18 weeks, providing comprehensive information, giving automatic access to free prescriptions, comprehensive care, and increasing funding for research into this condition. On that last point, Parkinson's is deemed incurable, but it does not have to stay that way, and treatment options are currently very limited in this country. More funding could certainly enable the development of innovative, life-changing treatments, or even a cure over the longer term. Progress has already been made on these 5 points in the Parky Charter. I know that this Labour government has already begun clearing the NHS backlog, with waiting lists down by some 219,000 since July last year. And I believe the government's elective reform plan will mean more neurological appointments every year. By providing extra appointments, scans and operations, particularly at evenings and weekends, the government can clear the backlog for neurological appointments, so everyone is seen within that critical NHS target of 18 weeks. More broadly, I hope the government's 10-year plan for our NHS will radically reform how people with long-term conditions like Parkinson's disease are treated through the NHS. The Health Secretary's action to clear the backlog, the 10-year plan and the elective reform plans have begun to improve care for those with Parkinson's disease, but we can and we must go so much further. Mr Chairman, I hope today's debate will galvanise support across the House for the vital mission of ensuring timely diagnosis, comprehensive care and dignity for all people living with Parkinson's. My constituents and their loved ones and families deserve absolutely nothing less.
Slade.
Thank you, Mr Stewart. It's a pleasure to serve under your chair, and I want to thank the Honourable Member for Colne Valley for bringing this debate. And it's interesting that 3 of the 5 backbenchers speaking are from Dorset. I don't know what that says about our population, but there we go. I should firstly register the fact that my daughter is currently under... very happily.
I will answer her question. Is one of my favourite facts about Dorset is that if we were a country, we would be the oldest country in the world by population age. So we're older than Japan.
My neighbour and friend is absolutely correct. We have the Jurassic Coast, but we also are the oldest county. My daughter is currently undertaking a PhD in the causes of Parkinson's, and I should also declare that I am a member of the APPG on Parkinson's. Whilst life expectancy for those living with Parkinson's is now much improved, the quality of life for everyone is deeply impacted, as they're incredibly vulnerable to falls and infections, limiting their ability to work, and the recent changes to PIP are causing deep distress to the community, and I look forward to hearing how the government will recognise the needs of those with fluctuating neurological conditions with their assessments. However, I want to focus on the issues of treatment and care for patients. There are 216 people currently registered as living with Parkinson's in my constituency of Mid Dorset and North Poole. And I've been told that there is virtually no service of specialist nurses or an active phone line support within my community, leaving vulnerable people isolated and at higher risk of traumatic, expensive and often unnecessary hospital admissions. As the Minister will be aware, an absolute diagnosis of Parkinson's is only possible post-mortem, so I pay tribute to the work of the Brain Bank at Imperial and also a similar MND Brain Bank at their institute at King's College London. And therefore, we rely on specialists to focus on the symptoms to make a diagnosis. But there is a significant problem, which was explained to me this week by a GP at Walford Mill Surgery in Wimborne when I spent the morning shadowing his surgery. He told me that wait times for diagnosis for Parkinson's can be more than 6 months. And so experienced GPs who are able to prescribe medications have a dilemma. They could help their patients by prescribing medications to reduce the symptoms, but in doing so make it more difficult for the specialists to diagnose the condition. And if the referral to treatment times were dramatically improved, GPs could ask people to wait. But with the current delays, it seems a cruel thing to ask both those living with the symptoms and their family doctor to do that. Which takes me to my next point, the lack of neurologists. The UK is 44 out of 45 countries in Europe for the number of neurologists per head of population. And the waiting list for neurological conditions now stands at a staggering 232,994 people. According to Alzheimer's research, neurological conditions are the leading cause of global ill health, with 3.4 billion people suffering a neurological condition. So it seems even more crazy that we have this problem. And not only this, but Parkinson's, along with other neuro conditions like functional neurological disorder and achalasia that I've previously raised, require multidisciplinary teams to look after them. And local NHS systems are just not set up to do this properly. So I want to ask the Minister if he will ensure that the NHS 10-year plan will deliver ways of working that will support such conditions. Finally, to touch on prescription charges, I know this has been raised before, but the list of conditions for free medication has not changed since 1968, and it is shocking that Parkinson's is not one of those conditions. My constituent Carol, who was diagnosed aged just 46, is finding this really tough and believes, as I do, that a full review of these conditions for working-age people should be undertaken now. And the final word must go to two of my constituents. Malcolm from Wimborne said, "I have suffered from Parkinson's for 10 years. It has changed my life completely for the worse. I cannot speak. I have frequent falls. We need better support." And Danielle, also from Wimborne, said, who was diagnosed at 38, "This is becoming more common in younger people, and the impact of this disease on my life is immeasurable. It's more than a struggle, it's a fight every day. We need these issues addressed urgently to help reduce the burden, and I hope that the Minister will be able to offer us some comfort."
And now to the front benches. Alison Bennett.
Thank you, Mr Stewart. It's a pleasure to serve under your chairmanship, and I'd like to thank the Honourable Member for Colne Valley for bringing today's debate. As honourable members in the Chamber have noted, Parkinson's doesn't just affect movement, it affects every part of life. It disrupts eating, swallowing, sleeping, mental well-being and independence. And while over 40 symptoms are recognised, each person's experience is different, as unique as their fingerprint. So I want to focus a little on one group today, the experience of women with Parkinson's. It's often more complex, more misunderstood and more neglected, and this was brought to my attention by a constituent of mine in Mid-Sussex whose own mother was diagnosed 6 years ago, and it took her mother 5 years to actually get an accurate diagnosis. Women are more likely to be misdiagnosed and more likely to be underdiagnosed. They're likely to experience delays in treatment and more likely to have their symptoms dismissed or attributed to anxiety or the menopause. Some research even suggests that women's Parkinson's symptoms may fluctuate more dramatically due to hormonal cycles, but we don't yet fully understand this because historically, like in so many other contexts, women have been underrepresented in clinical trials. Women with Parkinson's are also more likely to carry the invisible burdens of being carers themselves, all the while struggling with a progressive neurological disease. We need gender-specific research, treatment strategies and clinical training. We need health professionals who understand that Parkinson's in women is a critical gap in care that we must close. And when I submitted a written parliamentary question on this recently, the response revealed that NICE have no specific guidelines for Parkinson's that reflects these gender differences. We need, as a society, to realise how differently this disease can present in and affect women. And across the board, people with Parkinson's face long waits for specialist care, delays in diagnosis and difficulty accessing essential treatments. I recently talked to Richard, a constituent of mine in Mid-Sussex, who has Parkinson's, and he spoke of the profound difference these treatments can make. He told me that they make life-changing differences to him, and yet for too many they're inaccessible due to postcode lotteries that honourable members have mentioned and a lack of trained staff. And perhaps worse, in hospitals, some patients aren't even receiving their medication on time. For people with Parkinson's, that delay can mean the difference between mobility and being bedbound, between clarity and confusion, and between dignity and indignity. We've got to do better. We must also talk about mental health. Nearly half of all people with Parkinson's experience anxiety and depression, and as the disease progresses, up to 60% develop psychotic symptoms, and they are up to 6 times more likely to develop dementia. These are staggering numbers, so what needs to change? We in the Liberal Democrats are calling for urgent reform, starting with a full review of the medicine supply chain to ensure that no person has to live in fear of running out of vital medication. We want a faster approval process for new treatments by expanding the MHRA's capacity, not slashing it, as the government has done by cutting 40% of its workforce. Every person with Parkinson's and all long-term conditions need to have access to a named GP, because continuity of care should not be a luxury. We also need to restore the importance of mental health in NHS planning. The government's decision to let mental health fall as a share of NHS funding and to scrap targets for dementia and mental health is the wrong decision and is totally short-sighted. We also know that family carers are at breaking point, and I'd like to thank the honourable members for Aberdeenshire North and Moray East, Strangford, and the honourable member for Tewkesbury for raising the issue of PIP. We believe that according to the government's own assessment, 150,000 family carers are going to be impacted by 2930 as a result of the proposals on PIP, and this will be on top of 800,000 people losing PIP. Apologies. I would be interested to know whether the Minister has pressed his colleagues in the Department of Work and Pensions on this point about the issues for conditions like Parkinson's. People with Parkinson's should be supported not only to live, but to live with independence and with dignity. Parkinson's is cruel, it steals movement, independence and far too often hope. But we can fight back with the right policies, the right funding and the right political will, and we can make a difference. So let's listen to the voices of people living with Parkinson's, including women, whose voices and needs have been overlooked for far too long. Thank you.
Thank you very much, Mr Stewart, and it is a pleasure to serve under your chairmanship this afternoon, and I want to thank the Honourable Member for Colne Valley for their role in securing this vital debate, and to all members for their contributions. As we've heard on a number of occasions today, Parkinson's affects 153,000 people in the UK, and more shockingly, every hour 2 more people are diagnosed. For me, this issue is personal. A close family member was initially diagnosed and treated for Parkinson's. More recently, that diagnosis was revised to progressive supranuclear palsy, a rarer and more aggressive condition. This journey from uncertainty to diagnosis and then living with a progressive neurological condition has profoundly impacted me. I've witnessed firsthand the critical importance of early diagnosis, emotional support, specialist care, and above all, hope. Last month, ahead of World Parkinson's Day, I met Parkinson's UK and individuals affected by the condition. I heard powerful accounts from volunteers about the daily challenges they face with mobility issues, speech difficulties, and the emotional toll on themselves and their families. I will continue to commend Parkinson's UK for their tireless work, both across my constituency of Farnham, Borden, Haslemere, Liphook and its surrounding villages, and across the country, providing advice, support and advocacy at every stage of the Parkinson's journey. However, to date, I am concerned with the Labour government that the Labour government has yet to identify Parkinson's as a strategic priority. So can the Minister confirm what level of funding is being allocated to Parkinson's research this year and how this compares to the past 5 years? During my tenure at the NHS Getting It Right First Time programme, I was involved in the publication of the Neurology National Specialty Report. This analysis highlighted significant variation in neurological services across England, particularly in managing conditions like Parkinson's disease. The recommendations in these reports are essential to reducing disparities and improving outcomes. So can the Minister today commit to addressing the priorities in that report in detail beyond general references to cutting waiting lists? Under the previous government, Mr Stewart, the Conservative government, we invested more than £79 million in research into Parkinson's between 2019 and 2024. And in 2022-23, the National Institute for Health and Care Research enabled 114 studies related to Parkinson's through its infrastructure. We also rolled out a new treatment for advanced Parkinson's disease through the NHS starting in February of last year, offering an additional option for patients whose symptoms were no longer responding to oral medication. So I'd be grateful to the Minister if he can confirm that the Government plans to continue this momentum, what research funding will be maintained or increased, and what new treatment options are being supported or explored. The new Government has committed to updating the last Conservative Government's long-term workforce plan. When will they announce what level of detail and what specialist training there will be for Parkinson's nurses and clinicians? And will they maintain the focus on specialist care? Charities such as Parkinson's UK do an amazing job, but like many other sectors, they are having to respond to higher taxes and squeezed funding. So will the Minister outline how he is talking to the charitable sector to ensure that changes that the Government is making in the budget are not damaging Parkinson's care? Finally, what guarantees can the Minister offer that the recent restructuring of NHS England will not worsen access to Parkinson's services? With 50% cuts to integrated care boards, can the Minister reassure people that Parkinson's sufferers and their families will not be disadvantaged? I know that members from across the House are united in wanting to improve treatment, support and outcomes for people with Parkinson's. In a response to debate I spoke in earlier this month, the Public Health Minister said she'd be happy to meet with stakeholder organisations to discuss the Parky Charter and the progress of Parkinson's Connect pilots. I'd be grateful if the Minister could outline whether the Public Health Minister has arranged these meetings, and if not, when they might happen. A meeting would prove the Government's action, or would prove that the Government has action on workforce, waiting times, integration, support for carers and access to research and innovation. My colleagues and I in the Conservative Party stand ready to work constructively with the Government and with members from all parties to ensure that progress is not only protected but accelerated. Mr Stewart, let us match awareness with action, for only with action will there be hope.
Thank you very much indeed, Mr Stewart, and it's a great pleasure to serve under your chairship. I'd like to start really by paying tribute to my honourable friend, the member for Colne Valley, for securing this very important debate, and he spoke with real passion and conviction on this issue, as did honourable members from across the chamber. We had I don't know if it's a full house from Dorset, but we had West, South and Mid Dorset, and it was great to hear their thoughts, and of course the honourable member for Strangford, who spoke as always with great passion and conviction on this issue. I'm really grateful because it follows close on the heels of the backbench business debate for Parkinson's Awareness Month, which was led by my honourable friend, the member for Dunfermline and Dollar. And I would also like to thank other members who have spoken in both of those debates. I want to begin by paying tribute to the invaluable work of NHS clinicians, charities and care workers who spend every single day improving the lives of people with Parkinson's disease. I'm particularly encouraged by the Parky Charter, which is raising public and professional awareness about the needs of the Parkinson's community and the importance of timely diagnosis, comprehensive care and dignity for all people with Parkinson's. Organisations that fight for patients like Parkinson's UK are at the heart of our policies for the NHS, which is broken but not beaten. We look forward to working with them to fix the foundations of the NHS and making it work for people with Parkinson's in the Colne Valley, throughout Yorkshire and indeed across our country. Parkinson's disease can severely impact every aspect of a person's daily life, their family and unpaid carers. It can put people under immense strain, and they deserve additional support to help them to live with the condition. We know that there are around 153,000 people living with Parkinson's in the UK, and it's the fastest growing neurological condition in the world. We also know that about 16.5 million people in the UK, or 1 in 6 of the population, have a neurological condition, and 600,000 people are diagnosed with a neurological condition each year. Together, neurological conditions cause around 140,000 deaths every year in the UK, 1/5 of all deaths, and they are the leading cause of disability. In 2019, the NHS spent just under £4.5 billion on neurological conditions, and they cost the UK economy £96 billion. So tackling these conditions presents a real opportunity, not just for our health mission, but also for the government's growth mission. And we must face the fact that patients are facing significant challenges, including not enough people in the places we need them, delays to treatment and care, including long waiting times, and we listen to patients who tell us they've experienced a lack of information and support. We are acting to address these challenges, starting with our workforce. Parkinson's nurses and neurologists are worth their weight in gold, and they are key to meeting patient demand. This summer, we will publish a refreshed long-term workforce plan as a first step towards rebuilding our workforce over the next decade and treating patients on time again. We will ensure the NHS has the right people in the right places with the right skills to deliver the care that patients need when they need it. And we will set out in black and white the numbers of doctors, nurses and other professionals that will be needed in 5, 10 and 15 years' time. Turning now to waiting lists, the NHS Constitution sets out that patients should start consultant-led treatment within a maximum of 18 weeks from referral for non-urgent conditions. At the start of the year, my right honourable friend the Prime Minister announced our elective reform plan, which sets out our approach to hitting that target by the end of this Parliament. We have already surpassed our manifesto pledge to deliver an extra 2 million elective appointments, 7 months ahead of the deadline. We are now on 3 million appointments and counting. And many of these appointments included appointments for treating Parkinson's. Now, I know there may be some people with Parkinson's who are watching this at home who may be shouting at their telly and saying, well, I am still waiting for treatment. Because although waiting lists are coming down and recently fell for 6 months in a row, they're still high. And I completely understand why people who are still waiting are feeling frustrated. I'd like to say that to that person now, we are throwing the proverbial kitchen sink at waiting lists. And we will not stop until you see and feel the results. Turning to neurology services, the NHS has begun some important initiatives to improve their services, including the Neuroscience Transformation Programme, the Getting It Right First Time Initiative, a strengthened clinical reference group, and the appointment of a National Clinical Director for Neurology. The NHS is focusing on improving patient experiences, addressing the disparities in care, and ensuring patients are given their medicines on time. The Neuroscience Transformation Programme is focusing on faster diagnoses, better coordinated care, and improved access to specialist services. Mr. Stewart, at the recent backbench business debate, a number of honourable members, and also in this debate, of course, spoken about personal independent payments as an important way of helping people cope with the extra living costs of a disability or health condition. Those who can work should work, as I am sure all members would agree. However, I am happy to reassure colleagues that our Green Paper, otherwise known as Pathways to Work, will make sure that people with the most severe lifelong health conditions who cannot work will see their incomes protected. And we are consulting on that Green Paper to hear how best we can support those impacted by our reforms. Turning now to research, which is advancing our understanding of Parkinson's at breakneck speed. We continue to encourage research through targeted funding, infrastructure support and collaboration. For example, the UK Dementia Research Institute, sponsored by this government, is partnering with Parkinson's UK to establish a new £10 million research centre. And the NIHR is supporting research that has discovered eye scans that can detect Parkinson's disease up to 7 years before symptoms appear, which helps people receive treatment earlier and prepare themselves as best they can. Research also underpins the entire drug discovery and development process. I'm going to try and pronounce this word now, but I can't guarantee I'm going to get it right. Produodopa is a groundbreaking new treatment for Parkinson's disease, particularly for patients with advanced disease and severe motor fluctuations. It's revolutionary because it provides a continuous 24-hour infusion of medication via a small pump, providing more consistent symptom control. The NHS rolled this out in February last year. It's been shown to improve motor function, and it's proved its worth in significantly improving the quality of life for people that have advanced Parkinson's. Finally, at the last debate on the 1st of May, I know many members emphasised the importance of staying active. Indeed, there is strong scientific evidence that being physically active can help people to lead a healthier and happier life. For example, exercise can reduce the risk of major illnesses and lowers the risk of early death by up to a third. Our social prescribing programme is a key component of the NHS's universal personalised care and is a way for GPs or local agencies to refer people to a social prescribing link worker. These workers give people time, focusing on what matters to me and taking a holistic approach to people's health and well-being. They connect people to community groups and statutory services for practical and emotional support. Looking forward, we have committed to publishing a 10-year plan for health to shift the focus of our NHS from hospital to community, from analogue to digital, and from treatment to prevention. In the meantime, we've taken steps towards these shifts through the home-based care pathway, which is providing comprehensive support and care for people with Parkinson's in their own home. And through the NIHR's project to test a non-invasive vibrational cueing system, helping people with Parkinson's maintain their walking as they go about their everyday lives. I will give way.
Thank the Minister for giving way briefly, and thank you, Mr Stewart, and I congratulate the member for securing this debate. I declare an interest as both a member of the Parkinson's APPG and also the son of a sufferer of Parkinson's, and also my grandfather died suffering from Parkinson's. But would the Minister agree with me, whilst we all agree on the real challenges and what we must do to secure a cure for Parkinson's, we owe a great debt of gratitude to the partners, the spouses and the community groups that do so much to support those people suffering from Parkinson's as they go through a horrific both mobility loss but also deep psychiatric problems that are associated with Parkinson's.
Well, I thank him for that intervention, and he is absolutely right. Our system couldn't survive without the amazing and heroic work that our unpaid carers do. One of the things I've been proudest of in terms of what our government has done is the change to the carers allowance, which lifted the number of hours that a carer can work and still keep their carers allowance from £151 to £196. And I hope that that is giving carers the flexibility that they need. Many carers who want to work, but it's immensely stressful for them to balance their working and their caring responsibilities. And so that is something that I'm very pleased that we were able to announce back in January. But he is absolutely right. There is a lot more that we can do. I am working with colleagues in the DWP and in DBT as well, looking at this issue of how we can do more as a government for unpaid carers. But he's absolutely right to pay tribute to them. They are the lifeblood of our care system. Our consultation for our 10-year plan received over 190,000 responses, giving people with Parkinson's and other conditions a voice in the future of healthcare. And I'd like to end this debate by quoting just one of those voices, Winston from Lewisham, a former worker for St John's Ambulance. He said, and I quote, "People don't always see what's happening to me or what Parkinson's looks like on me." They don't see me early in the morning. They see me looking nice and managing the condition as best I can. But I have to deal with my own bubble sometimes, and it gets burst, and things go all over the place. Well, I am pleased that Winston is doing fantastically well, and he's now sharing tips with people on how to improve their public speaking abilities. But his words will resonate with anyone who has a long-term condition, and stories like Winston's should remind us why we need a health service that sees the whole person, not just the condition, to give patients the dignity and the care and the respect that they deserve. I would once again like to thank my honourable friend for securing this important debate and to pay tribute to all members for what I think has been a very constructive and powerful debate, and certainly look forward to working with honourable members on this matter going forward. Thank you.
Paul Davis to wind up.
Thank you, Mr. Stewart. I will be brief. Firstly, I would like to thank all members for their really thoughtful and powerful contributions. I think the consensus is very clear to be heard, seen across this room, and I think that, in its sense, is extremely powerful. We've heard from the Minister. I think the government's focus in making a difference. Clearly, the Parkinson's community want to see change, and they want to see change as soon as possible. And I think it's up to us to ensure that that pace of change happens as soon as possible. And I'm sure the people in this room, the members in this room, will continue to do that. Again, certainly pay tribute to the group supporting our Parkinson sufferers, and to those individuals themselves. I said it earlier on, but it's hugely inspiring to talk to people within the Parkinson's community. I think the strength that they have is remarkable, and we really need to repay that with that change as soon as possible to help them live their lives to a full, and to find a cure for this terrible condition going forward. Thank you.
The question is that this House has considered care for Parkinson's patients. As many are of that opinion, say aye. And of the contrary, no. I think the ayes have it. Order, order. The sitting stands adjourned. Thank you very much.